Hello, I'm Adrienne with the Pacific Open Heart Association. I'm one of a fleet of volunteers who would normally be coming to you live in the hospital and talking to you about our experience as someone who has had open heart surgery. 2 years ago, I had quadruple bypass surgery, and you'll find whenever you talk to somebody with Pacific Open Heart Association, we've all had open heart surgery. So we've been there, we've done that, and we have the pillow. And we're sorry that we can't come to you face to face, but hopefully this will help. So in this informal video, I'm going to cover 3 different areas. 1, some of the frequently asked questions. 2, an acronym to make the healing process easier. And 3, some tips for going home. So even if you haven't had surgery yet, or you have, I think you'll find some things in here useful. So let's get started. First of all, some of the commonly asked questions that people have. 1, does it hurt? Well, I have to tell you from my perspective, I am a wimp when it comes to pain. In fact, I didn't think I could survive the pain associated with what had to happen in this surgery. I'm happy to tell you I was mistaken. And so the pain levels are they did an amazing job in the hospital. The staff are so great. They did an amazing job taking care of that in the hospital. Was there discomfort? Oh, yes, there was, but it was very doable. It was funny when I was talking to my cardiologist ahead of time, and I said, when I go home, what's the pain management regimen? And he said, for you, it will be extra strength Tylenol. That's what we send most people home with. I said, what? Clearly you don't know me, because that will not be okay for me. Again, he was right, and it was just great. I did take the maximum Tylenol when I got home, but it was doable. So trust your medical team. They know what they're doing. They've done this before. The other question that often comes up is, when can I drive? And that is a little different for different people. But I know that ICBC has a mandatory 1 month you can't drive policy. And then after that, they apparently defer to your cardiologist. For me, my cardiologist said 2 months, so I couldn't drive, which is one reason why it's really important for you to set up rides in advance. Get people that you can call, services that you can call, whether it is for blood lab appointments, follow-up doctor's appointments, that kind of thing. And if you don't have anyone you can call, keep listening. I've got an idea for you later, okay? So that often comes up. People also ask, when will I feel better? And again, it's different for everyone. Here's my experience. I found that about every 12 hours in the hospital, right after surgery, I would feel a bit better. I hit a plateau at one point, but it only lasted a day. But the progress is astonishing. It's when you consider what they do in the surgery, it's astonishing how quickly your body can recover from that. The healing part, it takes a bit of time. But yeah, so I was working again in 3 months. It's not the same for every job, so listen to your medical team. But I felt, this is what people told me. They said, you'll feel good in 3 months, you'll feel better in 6 months. You'll feel really good after a year. And in 2 years, you'll feel like yourself again. And so I'm 2 years out, and I have to say that does track with my experience. At the end of 6 months, I thought, no, I feel pretty good. So this is probably it. But no, I did feel better after a year and really like myself again at the end of 2 years. So for what it's worth, the recovery period typically is, 12 to 15 weeks, which in the grand scope of your life is really small. So I mention that because it's important to be patient with the process. Okay, what other questions do I have? I have to look at my notes. Yes. How long will I be in the hospital? Different for everyone. They won't let you go until you're ready to go home. You'll find the booklet, the booklet will sort of go on a 5-day average example. And that's true for a lot of people. It was not true for me. I was in the hospital for 13 days, and that by no means is the longest that people have been in following surgery. So try not to feel pressured by the number of days you see in the book, and just know that your medical team won't send you home until you're ready to go. All right? They've got your well-being at heart. No pun intended. So, another question. Will I be depressed? This is different for everybody. And one of my family members who had open heart surgery said to me shortly after he got home, I have no feelings for you at all. So if that's the case, don't tell them. But it's not surprising that for a short period of time, you might feel not yourself, because there are a lot of drugs in your system. A lot of people experience some depression. If you do, talk to your doctor about it. Let them know, and they'll help you through it. I actually didn't experience any until I'd been home for about a month, and very short-lived. And I also found that when I got home, the number of medications I was on dropped off. And one of them in particular, every time I lowered the dose, it felt like a veil lifted, right? So it wasn't depression so much as I had more clarity. So it takes a while for the drugs to get out of your system. This is when you exercise that patience that I mentioned. Yeah. The important thing is to let your doctors know. One point that comes up a fair bit is people say I live alone, and will I be okay by myself? And my answer to that is no. No, you will need support through this. So, what if you don't have friends or family nearby? What if you don't have anybody? In my case, I take care of my aging mom, and I couldn't have her taking care of me, so it was sort of a double bind. Anyway, this is what I did. I asked the nurse to put me in touch with the hospital social worker, and she was amazing. She gave me all kinds of options, cleaning support, personal care support, and even food services, which were really helpful too. So my suggestion is, if you have any concerns about that, talk to the social worker at the hospital. And if it's anything like my experience, you'll find that they're very knowledgeable and ready to help. Okay, now that acronym I promised. On the Pacific Open Heart website, you'll see it. You'll see the article posted there. And it's CABLE. Usually by the time I'm talking to people in the hospital, I just go with ABLE, A-B-L-E. So I'll tell you about that. The A stands for ask and allow. And I'll be honest with you. This can be harder than recovering from open heart surgery, because a lot of us are strong, independent people who are used to being able to take care of things, right? And to suddenly need help. I mean, right after surgery, it's hard to even get out of bed. So it's an adjustment. It doesn't last a long time, but it is an adjustment. So having the courage and the strength to ask for help and allow people to help you will really help you in terms of the relationships you have with people and in your own recovery. One of the things I mention about asking and allowing people to help is how important it is to be clear on where you need help. Okay, so very often people will say, oh, hey, I hear you're going to have open heart surgery. Wow, if you need any help, let me know. And you say, okay, and then they go, and then you don't hear from them. And it's usually not because they don't care. It's because they've never had open heart surgery before. They don't want to be a bother, and they don't know what they don't know. So this is your chance to be clear with them and say, thank you. So as it turns out, over the next, 8 to 12 weeks, here's where I can use help. Getting rides to the doctor appointment or to the follow-up appointments and to the lab to get blood work done. I'll need help with laundry, and I won't be able to make my own bed. So that would be really helpful. Picking up groceries or delivering meals, walking my dog, if you have a pet that needs some care. And let them know, hey, you know what? We all have our own stuff. If you can't help with that, I totally get it. But if you can, those are the areas I'm going to need some help. So give some thought about where you might need some support. Because to be clear, you deserve that support and you're going to need it in healing. Okay? All right. So the A, ask and allow. B stands for be on the lookout for anything weird. And in the hospital, they're great. They know the questions to ask. But unless you've had open heart surgery before, you don't know what you don't know. And once I was home, I found that I'd started to cough. Now, I have some sinus stuff going on, and I knew I wasn't sick. So I didn't mention it to anybody. But by the time I had my cardiac follow-up appointment, I had no voice. And only because of that, he said, what's the deal? What happened? I said, I've been coughing. I'm not sick. I don't know why. Well, it was one of my medications. So, you might want to keep a journal, just a notepad that you can take notes for follow-up appointments to let them know what's going on. Also, because you've got a lot of the drugs in your brain, you'll feel like you're completely competent. And your memory might not be what it was just before the surgery. So while you're healing, it's probably a great idea to take somebody into the follow-up appointments with you to ask questions and take notes so that you can just be present. I found that very useful. Okay, so be on the lookout for anything weird. Also, to that end, I found that my legs started to ache. And so given my weird experience with the coughing and the medication change, I phoned my pharmacy. And I asked the pharmacist, am I taking anything that could make my legs ache? And she said yes. So again, a little tweak on the medication and it's fine. But that only happens when you're communicating. So you've got to let them know what you're experiencing. It's not uncommon. Everybody's different. So it's not uncommon to have those tweaks. But I wanted to let you know about them anyway. The ABL. Look at your progress from the day of surgery, not from weeks, months beforehand. Here's why. Open heart surgery is kind of a big deal. Right after the surgery, we can't even get out of bed by ourselves, right? So one guy I talked to was really having a rough time. And he said, 2 weeks ago, I could run up and down stairs, and now I can hardly get out of bed. Well, I thought, you just had open heart surgery. Be patient with your body. And so if you look at your progress from the day of surgery, you're going to be amazed at the leaps and bounds that your body takes in recovery. At least that was my experience. And I'm not a particularly fast healer. truthfully, but I really appreciated the fairly predictable set of steps in the healing process from open heart surgery. So look at your progress from the day of surgery, and heck, celebrate it. It's great. When you get to go to the bathroom with no adult supervision, when you can have a shower, these things are all great. And anyway, the E, finally the E, is something you might not be expecting. It is for ensure. Ensure the people around you, whether that's hospital staff, cleaners, or your people at home, ensure they know they're appreciated. And ensure they have the respite that they may need. A lot of caregivers at home in particular, you might have seen some of them before, they will completely forget their own needs to take care of someone who needs help. The problem with that is, while it's very well intentioned, they don't take care of themselves, so then they can't be of any use to anyone, really. And the truth is, you're going to need some support for a little while. Not forever. It's a really short period of time in the grand scope of life, but you'll need help. So ensure the people around you feel appreciated and get some rest, okay, and some chance to recharge. That will not only encourage better relationships, but it will help your healing because they'll be in better shape physically and emotionally to help you, if that makes any sense. So that is the ABLE acronym. A, B, L, E. Ask and allow. Be on the lookout for anything wacky. Write it down. Look at your progress from the day of surgery and ensure the people around you know that they're appreciated and get the rest they need. Oh, okay. Now I have some tips for going home, but the first one isn't for going home. It's for right now. You might find after surgery that you have no appetite. That was certainly my experience. I had to fight to even eat a tablespoon of food for every meal. But I did. And as one very wise nurse said to me, if you don't make food your medicine, medicine will become your food. So do your best to eat, and it will really help your body start to function normally again, and it will help your healing process. Okay, so now for the tips for when you're going home. Let me just look at my list. Oh, okay. You're going to hear this from every doctor, nurse practitioner, and physiotherapist, and I'm just going to add my voice to this, okay? It is really important that you cross your arms with the pillow or without the pillow if it's not handy. When you stand up, sit down, go to the toilet, when you cough or you sneeze, even if you open the fridge, right? This is a good thing. The seal on my fridge is really tight, and so crossing my arms just made me know that I'm protecting the sternum, because I don't want to freak you out, but the truth is this is held together with wire right after your surgery. So it's up to you. You are the only one who can really protect it and make sure it has a chance to heal properly, okay? So even if it feels stupid, cough, sneeze, stand up, sit down, go to the toilet, whatever it is, protect that sternum, okay? So there's that. But like I said, with the fridge, I found that really useful. Which, this position reminds me, the next thing I wanted to tell you about, I took advantage of the Red Cross loan program. It's really good. And I'll tell you the equipment that I got that you might find useful, okay? I got the Bedrail, because when I was getting out of bed and I pushed down on the mattress, it's like, oh, it goes down. But the Bedrail is something solid that I could leverage and get myself out of bed with more ease. So that was good. I got the 2-inch toilet rise, the lift. Wow, really helpful. It's amazing. 2 inches makes a big difference. And especially for the first week or two after surgery, I found that very helpful. I had a shower chair, which is important. And I also had a walker. there's a story behind that, which I think I'll share. Um, so I mentioned before how important it is to listen to your nurses and doctors, to your whole medical team and the nurse practitioners and everything. Well, a few days after surgery, they were walking to the bathroom with me, as they do, and said, "Let us know when you're done." To me, done means my hands are washed. So I was standing up washing my hands, and I felt queasy. I did not feel well. And I didn't say anything because I thought, well, that's not heart related. And then I felt really weak. So I sat down on the edge of a walker that was in the bathroom. And then everything went white and boom, I passed out. So got to tell you, passing out, fainting on the floor a few days after open heart surgery, not good. But I was lucky and everything was fine. I mention that as a cautionary tale to listen to your medical staff and just be aware that your strength, your capabilities, they're there, but for now, you really need to take care of yourself and listen to the instructions that you get. So learn from my dumb mistake. So there you have it. That's some of the equipment from the Red Cross Loan Program. And the physiotherapist in the hospital will probably fill out a form for you if you need stuff. And if you ask nicely, they might even fax it to the Red Cross near you. So a friend or family member can get it set up ahead of time for you, or you can pick it up on your way home. Okay? So that's that. The other thing, prescriptions. You're going to get probably a whole list of prescriptions when you leave the hospital. So a couple things about that. Again, if you ask the nurse and if you have the fax number to your pharmacy, somebody will probably fax it for you so that you or somebody else can pick it up on your way home. However, if you have any refills already in place, the new prescription overwrites the old one. At least that was my experience. So for stuff that I knew I had a 6-month supply of, in a month they said, "No, you have no more refills." I said, "Yes, I do." They said, "No, you don't," and explained that whole thing. So when you have your follow-up appointment with your GP, which often happens, to take the staples out and that kind of thing, make sure that you get refills on your regular medication, okay? It's not a big deal. My doctor happens to be hard to get into, so it was a little bit of a frenetic moment. There you have it. All right, what else do I have for you? Oh, walking. Walking is so important when you get home. I live in an apartment, so I would walk the floor of the apartment building with the walker because I'd hurt my knee in the fall. And I had somebody with me for the first little while. You know that old saying, no pain, no gain? It does not apply after open heart surgery. So please walk a lot and be mindful of what your physiotherapists, the rehab people, the nurses, the doctors tell you. Walk regularly and don't push it. So don't walk till you're tired because then you've got to turn around and come back. So find a way to make that work so that you can get that regular exercise. It's really important. The breathing thing also, even after you get home, you'll probably get that plastic chamber where you can practice breathing. I know that sounds strange. You'll find that you'll be able to get deeper and deeper breaths. It's a really important thing to do, so make sure you keep that up even when you're at home. It makes a big difference. Okay. Oh, and this was my first ever surgery. You may have had major surgery before. I had not. So a few things are weird to me, like scar tissue is weird to me. And also where the incision was, I found that the sensation was different. And I didn't know that that's normal. So Just so you know, if you've never had surgery before, it's not uncommon that the area that was cut, the sensation around it changes a little bit. If you have any concerns, obviously talk to your medical team. All right, so a couple of things before I go. Your friends and family, unless they've had open heart surgery, they may not get it. At Pacific Open Heart Association, we do. Every one of the volunteers, and it's an entirely volunteer-run organization, we've all had open heart surgery. So feel free to reach out. You're going to see in a moment the email address, the website, so feel free to reach out. The nursing staff will probably have numbers that you can call to be in touch with us if you're at Vancouver General Hospital, St. Paul's, or Royal Columbian. And we'd be happy to talk to you and answer any non-medical questions that you might have. And if you find this at all useful, the Pacific Open Heart Association would love to have you as a member. It's only $10 a year. But that's one of the ways that we raise money to keep it going. We have regular newsletters, and we're also able to do some donations for equipment to the hospital, which is brilliant, and we accept donations. You'll see that information in just a moment as well. Take care of yourself. Remember, this is just a short period of time in the grand scope of life. Please give yourself the time and respect to heal, and happy healing.